Hello classmates, welcome to the online class of Chinese medicine gerontology. Grandma Li next door often said that she was listless and had a cold rapidly. Grandma Wang downstairs fell again. What happened to them? In fact, this is the manifestation of senile weakness. Today we will learn about senile weakness. First of all, weakness refers to the non-specific state of the elderly's decreased physiological reserve, leading to increased vulnerability and decreased anti-stress ability. Western medicine believes that the causes of frailty are number 1, genetic factors, number 2, growth and development, number 3, aging factors, number 4, comorbidities. Number 5, malnutrition and insufficient nutrition intake. Number 6, demographic characteristics and lifestyle. Number 7, psychological factors. Number 8, drug factors. Chinese medicine recognized the occurrence of frailty in the age of Neijing. 素问上古天真论 said, as aging, the 5 organs are all declining. The bones are falling apart, and the tiangui is used up, which means that the frailty of the elderly is caused by the weakness of the 5 internal organs. Lin Shu Yin Wei Shen Hui said, the old man's qi and blood decay. His muscles are losing. The airway is drying. Its qi is less. Explained that the weakness is related to the deficiency of qi and blood. 素问阴阳印象大论 said, 40 years and yin and qi are half. Life is weak. Explains that weakness is related to yin and yang deficiency. Let's learn the etiology and pathogenesis of traditional Chinese medicine. Chinese medicine believes that the fundamental cause of senile weakness is old age and physical weakness. Illness caused by deficiency or deficiency due to illness. The main pathogenesis is the deficiency of one or more organs in the 5 internal organs, which is caused by the insufficient production of qi and blood. Among the 5 internal organs, spleen and kidney are particularly important. The yin and yang functions of the 5 internal organs and qi and blood are not only different, but also closely related, coordinate with each other and affect each other under pathological conditions. The following describes the clinical manifestations, evaluation, and diagnosis of the disease. The clinical manifestation of senile degeneration are divided into 1. Non-specific performance, such as fatigue, unexplained weight loss, and repeated infections. 2. Fall. Impaired balance function and gait are the main features of weakness and important risk factors for falls. 3. Cognitive impairment and delirium. The debilitated elderly are often accompanied by mental abnormalities, such as mild cognitive impairment, dementia, and delirium, hallucinations, and other mental abnormalities may occur under some stress conditions. 4. Fluctuated disability. The functional state changes drastically, which manifests itself as the function independence and the need for other people's care. So how do we assess and diagnose frailty? At present, the commonly used evaluation scale is the Freight Depravity Index scale. This scale is used as a diagnostic standard. Those who meet at least 3 following conditions can be diagnosed frailty. Who less than 3 are pre-debilitated, and 0 are healthy older adults. Number 1. Unintentional weight loss more than 5% within 1 year. Number 2. I feel tired myself most of the time last week more than 3 days. Feel that it is very laborious to do everything. Number 3. The grip stress drops. Number 4. The pace slows down. Number 5. Low physical performance manifested by decreased activity. Weekly physical activity for male is less than 383 kilocalories per week, and for female is less than 217 kilocalories per week. Additionally, there are SOF index and Rockwood K scale, which will not be described there. Below, we will focus on learning the treatment of debilitating TCM syndromes. The main points of the syndrome differentiation are the differentiation of syndromes of qi, blood, yin, and yang, and the differentiation of syndromes of the 5 internal organs. Qi deficiency syndrome. The organs prone to qi deficiency are lung and spleen, which can affect the heart and kidney. The typical tongue of qi deficiency syndrome is pale white and weak pulse. Under the basic tongue and wings of qi deficiency syndrome, each qi deficiency has its own characteristics. For example, the deficiency of kidney qi can show the waist and knees sore, hearing loss, frequent urination, clear and long after urinating, there is no end to leaching, or nocturnal urination, and leukorrhea is thin. And the treatment is to nourish kidney qi. Lung qi deficiency means shortness of breath, lack of breath, laziness, fatigue, spontaneous cold, easy to catch cold, pale complexion. It is advisable to replenish lung qi. 益肺固表. We can choose 补肺汤. Heart qi deficiency is characterized by shortness of breath, fatigue, self-sweat. We can cure qi and nourish the heart, calm the mind and nerves. Then we can choose qi food drink. And the characteristic syndrome of spleen qi deficiency is inappetence, abdominal distension, tiredness, and fatigue, loose stools, yellow complexion. So, to tonify spleen and qi, we can choose 加味四君子 soup. The blood deficiency syndrome is dominated by the heart and liver, and is related to the lack of spleen. The common tongue image is pale tongue. The pulse is thin or weak. The liver and blood deficiency can be seen with strain pulse, dizziness, and vision loss. Flank pain, numbness of the limbs, tightness of muscles, spasm, and so on. For liver and blood deficiency, we can enrich the blood and nourish the liver, and soften muscles and improve eyesight. The typical manifestations of heart and blood deficiency are palpitations, insomnia, dreaminess, dizziness, amnesia, and pale lips. Deficiency of heart and blood should be treated by nourish the blood and calming the mind and heart. And then the Yangxing soup should be selected. The 5 internal organs of yin deficiency syndrome can sing, read dry tongue, and pulse thin and frequent. These are common features. If yin deficiency and internal heat appears, tidal fever, night sweaty, and zygomatic rate, spleen and stomach yin deficiency can show dry mouth and throat, no appetite, heartburn and stomachache, vomiting, hiccups, dry stools. The treatment of nourishing in and liquid adjusts the stomach and middle. We can choose Yi soup. Liver yin deficiency can see dizziness, tinnitus, dry eyes, blurred vision, irritability, numbness of the limbs, and spasm. We can nourish liver yin and blood. Soften liver. We can choose Bugan soup. Lung yin deficiency with dry cough and lismouth, even cough up of blood, dry throat and hoarse. We can treat lung and cough, clear heat and nourish yin. So we can choose 沙参麦冬 decoction. Deficiency of heart and yin is characterized by upset, insomnia, apathy. Kidney deficiency is characterized by sore waist and knees, dizziness and tinnitus, death and amyotrophy. Men's spermatoria and women's amenorrhea. 左归 pill should be selected to nourish kidney and strengthen the waist and knees. Yang deficiency syndrome can be seen as sensation of cold and chill. Tone pale or dark purple, or white, pulse weak or thin. Kidney pulse deep and heart pulse thin. The typical symptoms of heart yang deficiency are heart palpitations, spontaneous sweating, tiredness, lethargy, and chest pain. The method is warming the heart yang, straighten the spleen, and replenish qi. We can choose Baoyuan decoction. Spleen yang deficiency, abdominal distension, low temperature, fatigue, tired, aggravation due to cold or diet, loose stools or unsatisfied bellies, treatment of spleen with warmness. Represent treatment is 附子理宗 soup. Kidney yang deficiency can see waist and knee soreness, men's spermatoria, impotence, polyuria, urination is unfavorable, early morning diarrhea. The method is warming kidney yang. We can choose 右归 pill. In addition to traditional Chinese medicine treatment, frailty also requires comprehensive treatment. First of all, emphasize on physical exercise. Resistance training and aerobic exercise are the most effective methods of intervening the frailty in the elderly. Second, we must pay attention to the nutritional support for the elderly. Third, strengthen comorbidity and multiple management of medications. Fourth, multidisciplinary cooperation, comprehensive evaluation, and development of individualized treatment and management plans. Fifth, reduce the harm of invasive medical and diagnostic equipment. Avoid excessive medical treatment. Sixth, reduce debilitating drugs. Senile frailty should be intervened early. The best preventive strategies include active lifestyle, scientific diet, moderate and regular exercise, good mentality, and effective management of chronic diseases and dementia. Okay, today's class is over. Thank you all.